Manual lymphatic drainage, also known as lymphatic drainage massage, is used to help speed up recovery after surgery to help decrease swelling, pain, and bruising. My name is Kelly and I am a certified lymphedema physical therapist as well as oncology and women's health therapist. As a lymphedema specialist, I treat a lot of individuals after their surgery, specifically to help get the swelling down. So in this video, I'm going to share how lymphatic drainage massage is done to help decrease swelling after something like a facelift or another plastic surgery. Some surgeons or doctors want their patients or clients starting to do lymphatic drainage massage right after their surgery the first couple days. Some want someone to wait a week or two until the incisions are fully healed, and some don't want it done for 4 to 6 weeks out. Every person is different, every surgeon has their own protocols, so you always want to make sure that you check with your doctor or your surgeon prior to doing any of this type of treatment. Then you want to see a certified lymphedema therapist or a specialized therapist to help show you specific and individualized technique that is safe specifically for you. In general, we see someone for about 2 to 4 weeks to help get the swelling down, and the treatment can be done daily. And in general, it is safe for someone to do this long term as long as they are doing it correctly and they are cleared for safety. Everyone is different and won't require the same amount of treatment. Seeking out a therapist who is specialized is always the best place to start, and they can teach you how to do it at home for you. The technique and sequence that I'm going to show in this video is really the most general one that we use in order to give you an idea of how lymphatic drainage massage is done. So before we get into it, I always want to make sure someone can visually see what is going on. So we know that the lymphatic system is a one-way system made up of lymph nodes and lymph vessels all throughout your body. When talking about your face and your head and neck area specifically, we know you have lymph nodes right around where your collarbone or your clavicle is, as well as below your ear and underneath your jaw. You also have small lymph nodes that are throughout your face and the back of your neck as well, but those are the major ones. In between there, you have lymphatic vessels that run through your face and your neck area. So if we were to draw a line down the middle of your face, we know the lymphatic vessels would run outwards towards the ear where those lymph nodes are, and then down the side of your neck towards the lymph nodes by your collarbone. Your lymphatic system plays a major role with your immune health to help decrease the swelling and bacteria and infection. So what happens is the fluid will run through the lymphatic vessels to your lymphatic nodes. At your lymph nodes, it's filtered and detoxed for any sort of bacteria or infection, and then it will move out throughout the rest of your body back towards your heart. What happens after a surgery is there is a lot more fluid, a lot more blood going towards the area to heal. That will back up the system. So what happens is you'll have more swelling, but if you have a compromised lymphatic system or there's congestion and backup, that swelling will sit and that can become really painful and cumbersome. So with lymphatic drainage massage, what we're doing is trying to stimulate the lymph nodes to speed up, as well as guide the fluid through the lymph vessels out of the face area, down the neck, and then out of the area to help overall decrease the swelling and the pain. So we're going to go ahead and go through lymphatic drainage massage of the face, head, neck area. If you're looking for a lymphatic drainage massage of other areas of the body, I have plenty of other videos of those. I'll put a couple of those down below, or be sure to subscribe to my channel for weekly new videos and new topics related to lymphatic drainage massage, lymphatic health, as well as oncology and women's health. So when we start, we want to start down by the collarbone or the clavicle. We know your major lymph nodes sit here as well as below the ear, and when the fluid moves, it goes out towards the ear and down. And so we start down by the collarbone. You want to use as much surface area of your hand as you can, right around there, best on bare skin, and you're just going to do large circles in the area. You'll do about 8 to 10 of those. You don't have to press really hard. Your lymph nodes, your lymphatic vessels sit right under the skin, so nice and gentle. About 8 to 10 times there. And then you can also stimulate the lymph nodes under your ear. So what I'll do is split the fingers into 2 and then do large circles on either side of the ear and underneath it. About 8 to 10 of those. And then you can also work underneath the jaw really gently. Again, don't press too hard here, and just doing large circles and stimulate those lymph nodes. After that, when you've stimulated your lymph nodes, then we want to go back and think about the lymphatic vessels. So we're going to start here to clear this area first, so this fluid has somewhere to go. And so I'm going to go from these lymph nodes below the ear to your collarbone, and we're just going to do short strokes all the way down, thinking about guiding the fluid downwards, nice and gently. About 5 times if you feel like it's not too backed up, but you can definitely spend a couple minutes there if you feel like it is, and just working the fluid down towards the collarbone. You can even wrap your fingers towards the back of the neck to get that fluid moving as well. But most of your lymph nodes, most of your lymph vessels are on the side of your neck, not right in the front. After you've done that area, then we're gonna work underneath the jaw. So starting in the middle and kind of working and guiding the fluid out towards the side where we talked about the lymph nodes are. And this is an area if you get sick or if you have any allergies and you feel swollen, this is a really good area to work on. But about 5 times there or more if needed. So then we're gonna work more into the face, so you can start below the mouth and you can work out towards the sides. So if you had a surgery for your nose, we know that the fluid and the swelling can drop down with gravity. And so we don't want to forget this area. And then after your face or your lower face, then we can work underneath the eyes on the sides where the nose is. So what I usually do, take both hands or one at a time if needed and kind of scoop underneath the eyes, out from the sides of the nose and out. And be nice and gentle. Kind of still guiding towards the ears area and working as much time as you need there. Again, always make sure that you check with your therapist or your doctor before doing this so that you're not pulling on any stitches or anything else. And after that, if you needed, you can work on the forehead, starting in the middle, working around towards the sides and towards the ears. You can spend, again, as much time or as little time as you need to, but once you're done, once you've worked as much of the face as you want and you're working everything back there, we just pushed all of the face towards the ear area, so we're gonna go back and work it all down the neck again. Spending as much time as you can, but trying to get your surface area with the full hand. After you've done 5 to 8 there, you can finish just all the way down near your clavicle or collarbone again, so the fluid can get back out towards the heart and clear. And that's it. Before you start, it makes sense that you want to make sure your hands are clean and your skin is clean to avoid any infection. Your therapist may also show you exercises and stretches to help with the healing. Again, each person is going to be different in his or her type of surgery as well as their healing process. So your therapist can work and make you a program that's created specifically for you. If you found this video helpful, please press the like button and I'll see you all at the next video. Thanks everyone.